This is the session on industrialization of cannabis. It's a very hot topic, and I am Dr. Blessed Okole, the research group leader, Agro-processing at the CSIR. This group falls under the Advanced Agriculture and Food Cluster, and we're doing good things in cannabis also at the CSIR. Today, I have two presenters. The first one is Professor David Katerere, and the second one will be Mr. Andy Radford. Professor David Katerere holds a PhD in pharmaceutical science from the University of Strathclyde, Scotland. He has worked in pharmacy, pharmaceuticals, and biotech research in the past 20 years in 4 countries and 3 continents. He is currently a professor of pharmaceutical science at Tshwane University of Technology, where he conducts research and teaches. He has several inventions to his name, including the nutraceutical Nicelo and COVID Connect app for use in clinical trials and post-recovery. David is chair of Pharma Connect Africa non-profit company, which convenes stakeholders in the pharmaceutical, biotech, and cannabis industries across Africa. He has published over 50 journal articles and is co-editor of 3 books: Ethno-Veterinary Botanical Medicines, which was published in 2010, Systems Analysis Approach for Complex Global Challenges, published in 2018, and Traditional and Indigenous Knowledge for the Modern Era. That was published just last year in 2019. David will be giving a presentation on building the cannabis and hemp industry in Africa. David.
So good day to you all, wherever you may be in around the world. I would like to talk about the building the cannabis and hemp industry in Africa, and maybe just share some of the ideas and some of the things that we are doing. Right, so it's all about money, money, money. And when people think cannabis and hemp these days, there's just such a focus on the money. And these are some of the figures that we're getting. The legal marijuana, as they call it on the other side of the world, the legal medical cannabis market size is going to be worth over $70 billion by 2017. And at the moment, it's a really big business, all sorts of figures. And this is the African outlook. And this is according to Prohibition Partners, who issue really interesting reports. And what they are predicting there, for instance, for South Africa, is an industry worth $1.7 billion, Lesotho 90, Zimbabwe, and so it goes on. And recently we found out that Rwanda has now also legalized cannabis. But I would like to say that these figures are really about primary production. And I wonder how many of them are actually looking at the industry itself and the value that that industry, if and when it comes together, can be worth. And that's what I would really like to talk about. Because when we look at Africa, we're really just looking at growing cannabis and hemp. Is that really an industry? And unfortunately, Africa has been very good at that, just extracting things. If you look at our mining, so-called mining industry, it's just extracting rock out of the ground and ore and sending it off. No value addition. And at the moment, everybody is fighting about trying to get a farm to produce cannabis. And nobody's really thinking about what is it that needs to go into building a sustainable and robust industry. Maybe let's start here. What is an industry? And by definition, it's economic activities which are concerned with processing of raw materials into finished value-added goods. And when you look at the way we are conceiving or conceptualizing the cannabis industry, are we thinking at all about manufacture? And in the work that we do as Farmer Connect and convening people and stakeholders in this space, we have found that there's very little going into the other aspects of the value chain. So, as you know, you can stratify industry into at least 4 different sectors: primary, secondary, tertiary, and quaternary. And at the moment, unfortunately, we are in this take it phase, which is growing things. What is it that we need to get into manufacturing things and then maybe selling services? And even better, what is it that will be required from the likes of the CSIR to actually sell information and expertise, which then moves this industry forward? So this is the value chain of cannabis as we know it. So there's cultivation that goes on, and in that could be the industry around seed, production systems and services. And then we have a distribution aspect to it. Dispensaries, for instance. At the moment, we don't really have these as formal structures. And then we can go on to the processing part. And at the moment, what we are seeing is that everybody's just extracting and processing the same things, really. Not enough consumer products as I speak. So this is what we need in Africa. This is what we would call an industry. And when you look at the actual value that is created along the value chain, and this is from the marijuana index, by the way, you'll find that down here, and in the cultivation and extraction space, it's highly crowded, and there's commodity exposure. So anybody who's in here should be prepared for bubble and burst. But as you move up this value chain into manufacturing, packaging, you then have high margins all the way to distribution. And so this is actually where more and more people ought to be playing, or at least ought to be thinking of playing. Let me give an example of pharmaceutical cannabis products, which we are not really talking about at the moment. We are really talking, I think, a lot about flowers, a lot about oils especially. But when we start looking at the pharmaceutical space, you can see here the exponential growth that is expected in this area. And at the moment, there are only 3 drugs really derived from cannabis. So there's a lot of room for growth here. So let's think a little bit about what an industry is. It's an ecosystem, in other words, a value chain. And in this case, we can conceive it as starting at the farmer level. So obviously the farmer will need input, so they'll need seeds, they will need greenhouses if they're growing under greenhouse. They will, and then once they have produced the cannabis or hemp, it then goes into the manufacturer. In some cases, the farmer can also be the manufacturer. And then the manufacturer adds value there, manufactures products that go into the markets. And these markets would be dispensaries, pharmacies, doctors' practices, where the consumer would then have access to them. Obviously, that money then goes back into the value chain. But what are the other important aspects of this ecosystem that we need to think about, right? Financing. We actually need to think very seriously about who is providing finance. Do we have venture capital funds available? Do we have government funding available, and under what conditions? And for which stakeholders in this chain? And then enabling legislation and regulations. We know from the South African experience that this has been problematic, and that's why people are marching on the street. Do we really need that strict regulation, or rather open up the market, give licenses, and let the market itself be the ultimate regulator? That sounds controversial, but this is what they've done in other countries in Africa, where they have set the price at slightly higher, but then people do get licenses. And what you find is that not a lot of them are then able to actually move from being licensed. So when we think about an ecosystem, which is what an industry is, interconnected stakeholders who are all of them adding value in one way or the other. So let's maybe think about how the cannabis ecosystem might work. It would obviously start with the farmer, but for the farmer to get off the ground, they will need inputs. So initially they might need capex, which might involve land, whether it's leased or it's purchased. They would need greenhouses if they are going to be growing the crop in a greenhouse, fertilizer capital, all of those inputs. And having grown the product and obviously having expertise, the product would then go to a manufacturer. Sometimes a farmer might also act in this case as a manufacturer. They would manufacture the goods, whether it's flowers or it's oils, or maybe it's some kind of API. And this then goes into the market, is distributed through wholesalers to pharmacies, dispensaries, prescribed by doctors in some cases, and eventually it lands up with the consumer. So the consumer then uses the product and pays for that product, and that money, in a sense, then goes back in that way. But what are the other pillars of this ecosystem? Well, there's financing, because in every part of this chain, money is required. So when we think about the farmer, the manufacturer, where are they going to be getting this money? And this is in the African context, right? Do we have venture capital out there that they can get? What we're finding is that a lot of the farmers are first-time farmers. They are capital raising naive, so they need a lot of support. The other issue is enabling legislation and regulations. And one then needs to be controversial here and say, really, is the licensing regime that has been created, particularly in South Africa, benefiting anybody, or who is it benefiting? Is it possible, for instance, to have a pre-licensing regime where everybody actually gets a license, and then after some time you actually go back and inspect? Because at the moment you need infrastructure before you get a license. So it's a typical pharmaceutical model. Whereas when you look at the other countries like Lesotho, Zimbabwe, all you do is you pay your fee, you get your license. And then that allows you, that license is an asset because it then allows you to go and get financing. The other issue is incentives. So in South Africa, DTI, Department of Trade, Industry and Competition has incentives, but they're not really specific to this industry. But if you're trying to build an industry, then you have to put in incentives. Research and development, this then creates more value than just a crop or a commodity in the ground. And again, we need to be focusing on that. Then we need to look at equipment suppliers. Where are our equipment suppliers? Are they landed on the African continent, or we are actually having to import equipment? And when we import equipment, is it the right kind of equipment? What maintenance is going to go on with this equipment? All of these really then require education and training, because you can't be an industry if you do not operate at a level where you are using training to come up with value-added goods. Maybe let's do a little bit of a SWOT analysis on this industry if we're going to build it. In Africa, the strength is that we have land and lots of it. We have sunshine, so the need for always growing under greenhouse conditions is not necessary, particularly with hemp. We have cheap labor, and that labor in some cases is highly sophisticated because they have been in agriculture for a long time. And in the tobacco growing areas of Africa, like in Zimbabwe and in Malawi, that expertise that's been grown in tobacco growing can now be used with cannabis. And so in terms of opportunities, we have that opportunity to build an inclusive industry because we know that people for generations have been growing cannabis in formal settings. So how is it then that we can actually bring them into a formal value chain? But one of the things is also to be able to clearly separate hemp from high THC. And I don't think that policymakers or even a lot of people quite understand what that separation is. The other opportunities is the entry of big pharma. So already Novartis, Sanofi, and Teva are getting into this space. So that means that there'll be a lot of demand for cannabis biomass. It is estimated through various reports that 49 million people globally currently use medical cannabis, but do not really have legitimate sources of it. So there's a huge unmet demand. And just think about other people beyond these 49 million who might potentially use it. Let's talk about the weaknesses. And you can see it's a whole basket list of weaknesses. There's legislative uncertainty. And we are certainly seeing that in South Africa. The population is becoming restive about that. And it appears to be there's also regulatory lassitude. And that taps into the idea that I threw out in the earlier slide to say, perhaps people should get licenses and let the market regulate itself. Then you have a policing regime where you then go into the market and actually see who's doing the right things and who's not. There are also issues around capacity. In this instance, we're talking about training and education is alluded to. In general, there's lack of an integrated approach, right? So having a farmer is not having an industry. Having products in a pharmacy shelf somewhere is not an industry. So we need an integrated approach. And one of the other things that's missing is the lack of testing facilities. This you find across the whole range, whether it's food, pharma, and now it's going to impact on cannabis quite soon. Licenses in Africa are export driven. So when you look at the Rwanda license, for instance, even South Africa, Zimbabwe, they're all about find markets elsewhere. And yet we should also be increasing access to good products for our citizens, the African citizens. There's been no training for doctors and pharmacists, as far as I know. I should know that because I teach pharmacists and I interact quite a lot with doctors. So you can't build an industry until the users know how to use the product. Right now, the cannabis industry is so informal that everybody is a doctor and a pharmacist, right? And then we have investment risks because, again, of the legislative uncertainty. An interesting example is the Proceeds of Crime Act in the UK of 2002. So UK companies are reluctant to invest in African markets where legislation is not clear, because it might turn out that they're actually being involved in criminal activity according to their home legislation. The biggest threats to the industry are lack of understanding of the industry by policymakers and by people who are in the industry. And then this leads to confusion also in the public's mind between medical and recreational cannabis. And there has not been any effort from the government, policymakers, or regulators to actually educate the public about the differences between cannabis and cannabis use in medical terms and recreational use. And of course, we might have the land and sunshine, but sooner or later, when we start having synthetic cannabinoids, then we will lose out on this opportunity. So what have we done? Well, from a TUT perspective, we are trying to gather different role players and actually set up a technology center. And this technology center would hopefully take care of a lot of these issues that we've talked about. And these are some of the potential services that would be provided by such a technology center. So pre-product level, it would be assisting with the proposals of governments across Africa, financial plans, because a lot of the people that we encounter are not really business people. They have land, some of them are informal farmers, but you need to package this into a business. And so that would also involve having project pre-feasibility reports, looking at regulatory landscape, and then of course, all of these other things, including coming up with MVPs and product evolution for the next 5 years. And then once we've at least assisted them at the pre-product level, assistance that the technology center would be able to provide on the product level would be around facility design and planning, which is very important, cultivation and greenhouse planning, because just these two on their own are very important because they are capital intensive. And then technical issues like material flow planning, equipment specification and documentation and tracking traceability. So this, in short, is really what we are trying to do, at least our small part in building an integrated cannabis industry in Africa. With that, I'd like to thank you. I am reachable on that email, and you can also attend Pharma Connect webinars that we're having, and a lot of them are focused on this industry, cannabis, and also the herbal industry at this stage. Thank you very much.
Thank you, Professor Katerere. It's been an interesting talk. You guys have heard about the billions and the millions in this industry. You also heard about manufacturing. I mean, our president, Cyril Ramaphosa, mentioned that we can't just rely on primary processing. We must also look at manufacturing. Why can't we manufacture and send to Africa and also to Europe? We should be looking at that area of the value chain, which is what I think we have to do. David also mentioned about the ecosystem and mentioned that there are many stakeholders in this ecosystem, and including financing, research and development. You can't stay on the same spot. If you don't have research and development, you will stay on the same spot. So it's very important for institutions like the universities, the science councils, to play a role in this area to try and get new products which are safe, efficacious, and affordable for South Africans. He also mentioned about the education and training. We must have the young people in the universities who should be interested in this field to try and study and have degrees that are related to this. We are doing that already now at the CSIR to have students who are doing their interns on cannabis in my group, and also the legislation. He also proposed something which was very interesting to me about pre-licensing. Pre-licensing, that's to first have this license and then later on look at those who are serious about doing it, because right now in the hemp space there are many people who have these permits and they are doing nothing about it. David also quickly looked at the SWOT analysis and mentioned that there are 49 million people using medical cannabis. This is a very small number if we in South Africa try to put it in place. I think South African population, if we get the therapeutic value of most of cannabis, is going to make a big difference. And he also lastly mentioned about the integrated activity. We must work together to get products to the market, to get safe, efficacious, and affordable products to the market. Now, our next speaker is Andy Radford. Andy has a master's degree in industrial administration from University of Cape Town and 20 years general management experience in various industries. Having been the director of the Biocomposites Center of Competence at the CSIR, he co-founded the Mandela Bay Composites Cluster in 2016 in order to bridge the gap between industry, academia, and government. He conceptualized and hosts the prestigious annual African Advanced Manufacturing and Composites Show. Andy is going to tell us about an initiative which we put in together involving the CSIR Nelson Mandela University and the Koega Development Corporation. He's working on establishing the Eastern Cape Natural Fiber Agro-processing Hub. Let me just quickly talk about this initiative. We want the Eastern Cape is very popular for hemp and production, and we want to put this consortium to try and see how we can harness the best and also give back to the community, to the Eastern Cape, on hemp and also on cannabis. Andy's talk is on industrialization of cannabis, focusing on hemp and hemp products. Andy.
Thank you for your time and for this opportunity to share a very exciting part of the future of cannabis in South Africa, and in particular the hemp offtake in the Eastern Cape. The Eastern Cape province has a natural fiber ambition and is looking at using cannabis as an emerging sector, and we'll be looking at some of the opportunities for it. The presentation, which I'll be running you through, comprises 5 focus areas. We'll look at an introduction to biomaterials, the competition which we're facing, especially in South Africa, in the bioeconomy. We'll pick up on the cannabis hemp value chain, then look at it as a new and emerging sector, and finally the application into the Eastern Cape. Now, a high-level view of biomaterials is a seed to crop, followed by a crop to a chemical, chemical to materials, and a material to a composite. So the seeds will obviously produce your crop, and from there you'll have 2 elements. The one is the value, which one looks for, the produce, and then the no value, which is often determined as and called the waste, leading to a chemical, and from the material through to the product. The seed to crop is an agricultural industry. The crop to chemical is chemistry. Into materials, we're talking material science, and finally, the material to the product is engineering. Some of the strategies that are competing, down the left here, we've got you need arable land, sunlight, water, and nutrients, and you'll be producing some food, some animal feed, biomaterials, and especially using the lignocellulose, you'll be producing ethanol, biodiesel, and biomass fuel. This then has a competition in the strategic space where one's competing against food security, other biomaterial strategy, some of the biofuel strategies, and definitely the bioenergy strategy. So the competition in the bioeconomy is around this food versus fuel debate, and food security obviously wins. After food, bioenergy is globally more incentivized than biomaterials, despite the fact that biomaterials directly support 5 to 10 times more employment and add 4 to 9 times more value. So following several rounds of recycling, energy recovery as end-of-life option makes biomaterials itself a versatile biofuel. And the mantra which one uses is cascade the utilization, but burn once. And even there, we're starting to look at not cradle to grave, but cyclical continuation. Now, at the bottom here, we have a typical Coke bottle. If it were made from a biomaterial, you'll have bio-PET. And then the whole recycling process is eventually around incinerating and extracting the energy. Some of the international market studies, biomaterials market is expected to continue to grow, certainly in the next decade. Biomaterials reduce the carbon footprint based on life cycle analysis. They're still more expensive than oil-derived counterparts, but we're expecting that gap to narrow as the production volumes increase. The current market is largely in the EU and USA, where one can afford to pay the green premium. The tendency is to commercialize intellectual property in the Far East, where the low labor rates result in cheap biomass. The oil price affects international biomass-related activities in general. I rather like this particular schematic of hemp and its products produced by our friends in Malawi. And if one looks at the stalk, one has bast fibers, just to define that. It's a fairly long and thin plant, and the actual stalk itself has on the outside bast. You might know it on a tree as bark, and inside you'll actually find some pulp. Now the bast can go into consumer textiles, industrial textiles. It can go into paper, as can the pulp from the leaves. And the pulp can be used by and large for building materials, and that's an important one because of the size and scale of the built environment industry. The leaves and the flowers can go to THC for medicinal purposes. And then if we look at the seeds, hemp seed oil can go to food, some products, even into some personal hygiene products, into foods such as granola and birdseed. And then the seed cake is a fantastic animal feed. It's very rich in protein. Finally, we have of the hemp itself agricultural benefits in the field, such as weed suppression, less need for pesticides, pollen isolation, soil improvement and crop rotation, and deep roots on natural soil aerators. So it's used for counter cultivation. And then we have over here, the whole plant can be used as a boiler fuel or pyrolysis for feedstock for it. And finally, the cell fluid itself can be used for forming abrasive type chemicals. I always use this slide to introduce the fact that we're not looking at anything new. Back in 1941, Ford recognized the utility of the hemp plant, constructed a car of resin, stiffened fiber, and here it is. This was including hemp into their composite. And then they later even ran the car on ethanol made from hemp. So Ford knew that hemp could produce vast economic resources if widely cultivated. Looking at some of the advanced manufacturing biomaterials, one has biopanels, phenolic sandwich panels using what's called as the vacuum-assisted resin transfer technique, bioplastic panels where the fiber is put into a plastic, phenolic sandwich panels, and that was flax, whereas here we have Kennaf, where one makes a polypropylene parcel tray, or for that matter, over here we have the Mercedes-Benz C-Class door liner. And this schematic shows the process where, in this case, it's a Kennaf fiber. It's grown, in this case, in Winterton. ARC did some research in terms of stripping the bast fiber off it. But by and large, it's done in a more industrial way. And this is the Sustainable Fiber Solutions factory in Winterton, owned by the IDC, but currently not in operation. And one ends up with this type of fiber. As you can see, it's fairly light in color, and it's a fairly clean fiber. That can then be added to some polypropylene and thermocompression molded into a part for a motor car. Similarly, we ran some trials with Nedbank and used the fiber, and here it's a vacuum-assisted resin transfer molding to produce a Nedbank sign. Now, if we look at mechanical properties versus the weight advantages and the additives, one has plastics and resins down here. One then reinforces those plastics, and you have what we call short fiber reinforced plastics. And this is really, from a macroscopic perspective, it's homogeneous. You actually can't discern the fiber inside the plastic, and it behaves, processes, and designs like a plastic. One then goes into this macroscopic inhomogeneous environment where one has long fiber reinforced plastics, and then non-wovens, wovens, and unidirectional fiber reinforced plastics. And it now starts behaving like a composite material comprising a resin, plastic, and a fiber reinforcing. So over here we have material science focusing on this type of product, and then we have more on the engineering side, what happens over on this higher mechanical properties, and more weight advantages. We have material design and manufacturing as what we call the trinity of composites, that if one changes the manufacturing process, one often has to go back and modify the design. If one changes the material, one often has to modify the design and the manufacturing. And so the three are always actively involved in influencing one another. Some emerging insights, some global emergence of the cannabis industry. There are 9 pillars of the cannabis markets: policy, regulation, taxation, compliance, laboratory testing, data reporting, cultivation, extraction and processing, and of course, education. So the sector contributions, there's about 50 countries that have developed legislation for legal cannabis. The largest producers are China, the Americas, Canada, Chile, and France. And then from a sector perspective, what are the challenges and constraints? Is really around policy, regulations, compliance within the policy and regulations, and obviously reporting with that. Cannabis testing is the only means to ensure product quality, and one has to actively educate and inform stakeholders. And I'm very grateful for this opportunity with the CSIR to have influence over the decision takers that are influencing all of these elements of the 9 pillars. The opportunities, which is more around industry pull, is that the market is projected to grow from about $10 billion in 2018 to about $40 billion in 2023. So we're looking at a compounding annual growth rate of just over 30%. North America is expected to grow at about a 16.9%, Asia Pacific at about 16%, and Central and South America markets is driven by growth in consumption for oil, for pharmaceutical and food and beverage industries. Let's have a look at a comparison between medicinal and industrial. So a similar plant, different genetic formulation, where it's fully legal in certain of these countries, shown in light blue, down to purple, which is illegal, and dark blue, where it's federally illegal from a policy perspective. And on this side, we have industrial hemp, and all the regions where it has currently either been produced or has the potential to be produced. And you'll find an overlap between those which are fully legal and those which are legally compliant with those which are able to and are currently growing industrial hemp. You'll notice South Africa sitting where we have got the potential to do both. This potential will provide for us significant employment. And we'll look at 2 scalable options. One is at 5,000 hectares of arable land, just over 33,500 people, an income of it's over 500 billion rand, carbon sequestration of 37,000 tons of CO2, and the soil rehabilitation of the full 5,000 hectares. We mustn't forget the rehab capability. On the 20,000 hectares, we're looking at significant employment, an income of just an astounding amount, and from a sequestration of carbon over 150,000 tons. The emerging insights is that our heritage and our culture are actually quite closely tied up to this particular plant. You'll notice here in the Eastern Cape, women working in the fields. And the bill around the cannabis industry in South Africa has a primary objective to protect indigenous knowledge, and especially of those indigenous communities from unauthorized use. So we've got some very clever genetic capability in South Africa, and it would be a terrible situation if it were misappropriated and misused. So we really do need to all work together to regulate the fair and equitable distribution of benefits from its commercial use. I'd like to acknowledge the following. Dr. Kelvin Reiswijk, who with me did a biomaterial feasibility study, working for DST in 2016. The presentation to the NACR workshop on the South African bioeconomy and progress in 2019. And Dr. Sunshine Blow and Ms. Micah Vetz of Kucha Development Agency and Takadu Development Agency, who last year provided some significant inputs to the Eastern Cape government and developed an Eastern Cape hemp model. And that brings me to the conclusion of the presentation. Thank you.
Yeah, thanks, Andy, for that wonderful presentation. I'll just try and give a summary of what you presented. I think first of all, I just want to clear this thing about cannabis and hemp. Both of them belong to the genus Cannabis sativa, and one we call marijuana here. The main difference is between cannabis and hemp is that hemp has very low THC, which is the psychoactive effect, and then marijuana has a very high THC level. And on the height of the plant, marijuana is a shorter plant, around 0.5 to 1 meter height, while hemp is a very slim, tall plant because of the fiber that it produces. It grows up to around 3 meters or to right up to 5 meters. So it's a very tall plant, depending on the variety. So that's, if you see them in the field, then that you can easily differentiate them. He also talked about the modern uses of hemp and what you can use the stalk for. Mainly, they use the stalk for the fiber, which you can use for different products. He showed the car that was produced in 1941 by Ford, but CSIR also did something not on Ford, but on a Benz. So we kind of ahead in this game. We just need to go back again, because now that we are going to legislate it, to try and make it more user-friendly and to make it affordable to at least to bring those people, especially in areas in the Eastern Cape, KwaZulu-Natal and Limpopo, that are growing the crop illegally, to try and have an inclusive market for this particular crop. I think he also mentioned about the mechanical engineering and the chemical engineering, and I would just like to highlight to you that all of this is currently happening in South Africa. And Nelson Mandela University and also Durban University of Technology have faculties that are dedicated to non-woven and woven materials in this particular area. I think one of the highlights also was when you have at least 20,000 hectare or 5,000 hectare, what you can get from it. And he also highlighted about the consortium base of working, which is what we are trying to do. And the CSIR had this pilot facility in Port Elizabeth, but we realized that it's not easy to do it alone. So we're trying to bring this consortium between Nelson Mandela University, Koiga Development Corporation, and also we want to also involve the DTI, who will be the sponsor of it, and IDC. So it's going to be a big consortium on hemp. Thank you very much. So we will now open the floor now for questions and answers. Okay, we now have this session now is for questions and answers, and there are some questions that are coming in, which I would like to present to our speakers. The first one is from Eugene Tuta. He said, "Good morning, thank you all for giving us a thorough view in the cannabis industry. What are the requirements to get the relevant licenses, and how does the qualification criteria work?" I think I'll direct this particular question to David, because he has some insight in the SAPRA area before the next question. David.
Thanks a lot, Dr. Okole. So I think we're talking about medical cannabis licensing, right? So you get the form from SAPRA, and what they need there is a site master file. So in other words, you actually need to get a photograph of the site where you're going to put, and they're following a very pharmaceutical way in which we license pharmaceutical manufacturing facilities. So you will then need a site master file. You will need to be able to have a diagram of the land, including the facilities themselves. And then you will need to give an idea of security features. And then, of course, GMP areas. So in terms of your extraction areas, they will need to meet GMP. It's very high level and very technical. So you also need a pharmacist who will be your responsible pharmacist to be able to complete this kind of paperwork. And that is why I think in my presentation, I say that this is quite onerous and should probably be looked at because people are paying upfront and then they're being licensed for an open piece of land. You know, because actually in the pharmaceutical sector, what we do is people are licensed for a physical facility that you have to see. So what it means if you have to follow that is you have to put in an upfront investment of anything between 5 and 10 million rand. Thank you.
Wow. Thanks, David. I think you can also get this information on the SAPRA website. They have on their website, the requirements are also there. If you're interested in setting up a business in the cannabis, medical cannabis sector. The second question is from Marcelo. I think we all have to answer this. It's kind of a general question, but it's a question. It said, why change the winning formula, like illegal shebins in townships that raise families? Cannabis has been farmed and produced without any legislation or any form of rules except its illegalities. Therefore, why is the regulatory bodies not giving farming licenses like for all farmers as its uses for proved best results? It's a double-barreled question. And then the second one is that why are we not allowing the needy to use this for economic emancipation and development? David, do you want to take that? You have more pharmaceutical. I know it's a regulatory question, but if you could just give some insight. I will forward the question to Daphne also to give a full answer.
Okay.
Later on.
Yeah, that's fine. Look, so as a member of the United Nations, we are also then supposed to follow the INCB guidelines. So this is actually something that goes back to 1962. And therefore, I think you pointed out to the fact that there's an illegal trade. And this illegal trade cannot be mainstreamed unless we follow United Nations guidelines. So you can't really, and United Nations, the INCB then gives quotas for each country to be able to grow and to export. So there's no way that you can export illegal contraband. That's what it becomes. And for us to unlock this area, we actually need to legalize it. And it should be easy enough to legalize it. So and that should benefit everybody. I think Andy talks about the hemp industry. I've talked a lot about the medical cannabis industry. So it's a huge industry, and by actually regulating it at a fairly low level, you then open up the market for formal trade and for international trade. Maybe Andy might want to add on. Because
Andy, do you want to add something on that, please?
Yes, thank you. I would like to just clarify that the two genetic crops, the one used for pharmaceutical purposes and the other used for fiber purposes, actually can cross-pollinate and can result in a hybridization. And that is for us a huge risk. If the fiber phenotype were to hybridize with the cannabis one, the marijuana one, it will result in a much weaker THC content and would actually reduce the value of the marijuana. Similarly, if the marijuana were to hybridize with the fiber crop, one would see an increase in THC and would then actually be a problem because it needs to be kept below a certain minimum level. You've heard certain limits being given as 0.001, and we work towards a 0.03 and so on. But these are very low levels, and it would then be very difficult to produce a legal fiber as a result of the hybridization. So one does need to have regulation in terms of what you're growing it for, if it's pharmaceutical or whether it's for fiber. When I say fiber, I also mean, of course, other off-takes from that particular plant. And they need to be planted very distant to each other, a couple of kilometers, in fact. And one needs to take into account wind, pollination, and so on. So I think there is a good reason for legislation, but I think it is time for us to actually start deregulating or introducing regulations and activities, controlling activities, behaviors that we can actually get going in South Africa. It's a great industry. It's got huge potential.
Yeah, thanks, Andy. There is another question again. We're talking about inclusivity. How can we facilitate the inclusivity in the Eastern Cape? I think, Andy, you can answer that since you're in the Eastern Cape.
I certainly would like to. Thank you. The inclusivity approach, which has been used for sugarcane in KwaZulu-Natal, is what we're wanting to mimic in the Eastern Cape. And it's where commercial farmers and community-based farmers actually work together. That to establish economies of scales, the community farmers are discouraged from putting up fences. And the reason for that is that one can use equipment that is usually used commercially, also within the community-based farming environment. The economies of scale is critical when it comes to industrial crops, especially for fiber.
Thanks, Andy. And the last one before we close the session is for David. How can we be the leaders in Africa? Because you mentioned that what do we have to do in South Africa to be the leaders in Africa in this cannabis and medicinal cannabis? David.
I think a few things. First of all, we have to realize that the world is going to move on if we don't give licenses. So what I would suggest is that they should actually, at least for medical cannabis, there should be a pre-licensing regime where people apply, they get the licenses, and then that they can actually then take to a fund, a bank, to be able to unlock the resources that are needed to then put up a plant. And then you let the market itself regulate to a large extent, because not everybody is going to necessarily get that funding, right? So we heard earlier about government funding, and that's if they qualify to get government funding. And then I guess the other thing is to look at this as a value chain. At the moment, everybody is on the low end. They're talking about the agro side, but the agriculture side is not as easy as we all think it is. It's also very sort of low value in terms of yield, for instance, and there are all sorts of climatic issues that can take place there. But I think what we should be doing is to rather regulate the production side of things. So, give as many licenses as possible. And that's what the other countries are doing. If you go to Lesotho, for instance, there are, a lot of people have licenses, but how many of them are actually in production? Not many, because then the natural attrition is that then funding and also the ability to actually grow or to produce then becomes more restricted.
No, thanks very much, David. I think we also have to look at the whole value chain. We have the skills, the manpower, the finance also is in the country to look at the whole value chain in getting this to the market. And I think the universities, the science councils have a big role to play to develop those new products, because you have to go really deep into R&D. We heard what Professor Matabise said, that to develop, we have to be unique in what we are going to put into the market. It's not me to go what is being done in the US, in Europe, you want to do it also in South Africa. You want to get unique products that are unique, that you can also sell. I will say this again, sell to Europe, to Africa, to Americas, and also put a proudly South African cannabis product on it. And there are many things we can do. We can in the cosmetical, nutraceutical health, which is very wide. We heard about cancer, we heard about pain, and different areas that we can look into, different therapeutic areas that we can look into. So I hold the research institutions and the universities to play a big role into it. Not only that, we also now have to look at the private sector. What is the private sector? How are they going to take this now into the market to make sure that the communities make full use of it? How can we also help those who are already in this industry, those people, communities in KZN, in the Eastern Cape, in Limpopo, who are already growing this crop? How can we help them to benefit, the socio-economic benefit from it? We don't want that boat to leave without them. We have to work inclusively to bring them also so that they can also make money from this cannabis, and the government also has to help in regulating so that they become part of the system. I would like to conclude on these remarks and thank my two speakers. Thanks, David. Thanks, Andy, for this presentation. Thank you very much.
Thank you.